Today, CVS told us that you do have to have a prescription from your doctor to get the vaccine in New York, but Walgreens said you should ask your pharmacist. So I asked Dr. Thomas Russo to clear things up for us today.
According to Dr. Thomas Russo, the chief of infectious disease at both UB and the VA in Western New York, the approval process for vaccines is a two-step process. Step one, the FDA licenses the vaccine. That happened last week for people 65 and older and for those 6 months to 64 years old with an underlying condition that puts them at an increased risk of developing severe COVID. The second step is for the CDC to make recommendations. That hasn't happened yet. Dr. Russo says New York is one of 16 states where pharmacists are only authorized to administer vaccines recommended by the CDC.
Last year, greater than 90% of Americans received their COVID vaccines through their pharmacies.
A spokesperson for CVS told us today you need a prescription to get a COVID vaccine at its stores in New York and Pennsylvania. Walgreens said it offers the COVID vaccine to people 65 and older and people under 65 at high risk as determined by the CDC. But Dr. Russo says questions come up for people who get the vaccine off-label.
Even though it hasn't been authorized by the FDA, a physician can decide, I think this individual should get vaccinated, and can make the decision to either vaccinate that individual themselves or write a prescription for them to be vaccinated. But there's uncertainty of whether the pharmacist will go ahead and administer that vaccination. In this case, a healthy individual from 6 months to 64 years of age, even though they have a prescription. And that's largely due probably to liability issues.
A spokesperson for the Erie County Department of Health told us pharmacies in New York might require a prescription depending on your age and health conditions. A spokesperson with the State Education Department, which licenses pharmacists, says it's working on guidance for the pharmacy field with the Department of Health and the governor's office. And if you go off-label, Dr. Russo says there are questions about insurance coverage. He says out of pocket, the vaccine could cost around $150.
And I checked this afternoon, and CVS does have an option for you to schedule a COVID vaccine online. But if you're under 65, it asks if you have an underlying health condition putting you at a higher risk. And the CDC committee meeting is scheduled for September 18th and 19th. At least one U.S. senator has asked for it to be postponed indefinitely because he has concerns about the makeup of that committee. On your side, Kelly Dudzik, Channel 2 News.